In today's COVID 19 update, we speak with the Honorable Minister of Health, Dr. Frank Anthony, about operations at the Infectious Diseases Hospital. We also speak about the COVID 19 vaccination campaign for children in the country.
Most of the areas in the hospital is working. Um, we have an ICU and we have been expanding that area. We have other sections like the pharmacy. We do take off laboratory samples and we send it to GPHC's lab to do the testing. So most of the key areas have been working, and we have been able to treat a number of patients there since we have opened. Well, of course, because the majority of patients that are there because of COVID 19. And as you know, COVID 19 is an infectious disease, and therefore we need to have people isolated so that they're not infecting others. But while they're isolated, because they have a severe form of the disease, that we are able to provide them with adequate treatment. And to do so, um, you have to get both medication, you have to get the equipment, the relevant equipment, and of course the personnel to be able to manage these patients. We have, over the last year or so, been able to purchase a lot of equipment, which include the specialized beds that people would need, the ventilators, the monitors, and of course to make sure that we have constant supply of oxygen. These are the prerequisites to ensure that these patients can be properly cared for. The hospital technically was opened on the 31st of July 2020, a formal opening where former President Granger went there to do the official opening. But they opened a place that was not functional, and when when we came to government, and we had the first opportunity of going into the facility, we discovered that even with the infrastructure works that were being done, that it was not done properly. Um, the building was not connected to the electricity. There wasn't any water going to the building. The sewage system was not connected. We had to build a new sewage area and so forth. So all the utilities for the building was not operable. In addition to that, there was no backup generator or anything of the sort. Medical gas, which is an essential thing for COVID patients, oxygen, medical gas, none of these things were installed. So we had to put in those lines, install the relevant piping to make sure that we can deliver oxygen to the patients who would need it. So it took us a while to be able to put all these things together. And of course, we did not have a single staff that was assigned to that hospital. So we had to find staff and make sure that we had both nursing, ancillary staff, and of course the physicians who would be working there. So it was a challenge to operationalize the hospital, but nevertheless, we were able to do that. We took over from the 5th of August, and we were able to get our first patient in there on the 1st of September. The person who had ownership of the facility was claiming that the APNU had an agreement to rent the facilities from him, um, but those matters are engaging the attention of the Attorney General. And I saw somewhere in the press that Mr. Basil Williams would have said that the building was under receivership, and that's why the APNU, I think on the 29th of April, would have issued an order to acquire the building. But those legal matters would be best dealt with by the Attorney General. I want to encourage people to make use of this opportunity, come out and get your vaccine so that you can get protected. We have had, yesterday, we were at two sites, one on the East Coast at Bladen Hall, and we were also on the East Bank at Diamond. And I think we had a very successful day yesterday because at Diamond we got 538 students who got their vaccines, and at Bladen Hall it was 697 students who got their vaccine. So far, since we've started this exercise last Thursday, as of today, we have given out about 3,412 doses of the Pfizer vaccine to our children. So it is going good. We have a very strong partnership with the Ministry of Education, and it is rolling out smoothly. So our numbers now, we have 315,279 persons who would have received their first dose of a vaccine, COVID-19 vaccine. That is now putting us at 61.5% of our adult population. And we have 162,806 persons who would have received the second dose of their vaccine. That's putting us now at 31.7%. What you'll have when you use, like when you're sanitizing with alcohol, if you have other pathogens, germs, and on your skin, it would help to reduce that germ population on your skin and therefore reduce your chances of getting infection. However, the alcohol would have to be at a suitable concentration before it to work. If you're diluting it and it's very diluted, then it would have very little effect. So a lot of this has to do with the concentration of the alcohol in what you're spraying.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.